Let's look at benign prostate hypertrophy, BPH. What is the definition? So this is the condition in males, okay, in which there is non-malignant enlargement of the periurethral prostate gland, okay, which is actually characterized by, okay, sensation of incomplete emptying of the urine, okay, also recurrent urinary tract infection, urinary retention, and so on and so forth. Okay, so that is the definition for BPH. Now, how does BPH come about? What are some of these causes? The causes are not really known or rather understood clearly, but it is believed that it is associated with sexual hyperactivity, okay, and the effect of some hormones called the estrogen. It has got the great effect on this actually. Okay, what is the pathophysiology? Let me take you back to the normal physiology and the normal growth of this, prostate gland. So as a man actually matures, the prostate gland actually, goes through two main periods of growth. So the first growth actually occurs in early puberty, so when the prostate doubles in size, and then when you reach 25 years, the gland begins to grow again. So this second growth actually phase, growth phase actually, often result in enlargement of this prostate gland later on if it continues to grow. Now, so as the gland enlarges inwards, it reduces the area, okay, it reduces the area in which the sperm duct and the urethral, urethra pathways, okay, so thereby squeezing the tubes to a much smaller size, leading to narrowing of the urethra. Okay, so this narrow opening of the urethra causes the pressure of urine passing into it to increase, leading to an increased pressure in the bladder as well, because it will have nowhere to go. So the bladder will have a lot of urine that will not come out, so it will cause pressure in that. Therefore, the male, as a man actually, you'll be failing actually to actually empty the bladder, but you are going to have frequent menstruation because you'll be feeling the urge to urinate, but the urine will not come out as much as it can. Okay, so that is what will happen. So sometimes this causes loss of libido as well. So the libido, because you cannot even enjoy actually, you have frequent menstruation here and there, and you want to have affair with a partner, so this is going to contribute to not having fully affair with a partner, so you can lose actually libido. Okay, so with progressive compression of the urethra and obstruction, what will happen is there is increased risk of secondary infections and also development of renal calculi, okay, due to urine stasis. Renal calculi, sometimes you call them stones, renal stones, because the urine is so concentrated plus some other substances. So this is going to cause you to have form stones inside the bladder. Okay, so the bladder becomes distended, and there is retrograde flow of actually urine, which can impair renal function and promote hydronephrosis. Okay, this can result into hydronephrosis. Okay, so what will happen is that in the later stages, actually, the flow of urine may become completely blocked, you know, causing what we call pyelonephritis. Okay, it can also cause uremia. It can also cause, you know, sometimes even death, because the kidney might be impaired. But what are some of these signs and symptoms? What are some of the signs and symptoms of benign prostate hypertrophy? Okay, difficult to start passing urine. Okay, there will be difficult to start actually passing urine. You can, you know, people struggle, you know, you struggle for the urine to come out. Actually, they do struggle because the lumen of the urethra, actually, you know, it's squeezed, it has become small. There is also diminishing in size and force of the urinary system. Okay, the weak stream. Okay, there is also strain at passing urine. Okay, there is also cessation of incomplete emptying. There is also frequent trips to the toilet, including nocturia, because you are not really emptying the bladder, so each time you'd want to feel like you want to urinate. Okay, there is also feeling. There is a feeling of a burning sensation or pain when passing urine. There is also recurrent urinary tract infections, urinary retention, abdominal straining, and micturition. Okay, what are some of the investigations that you must do to actually confirm the diagnosis? There are some of the investigations that you must do. Do the proper history taking for taking about the pain when urinating, how often do they go to the toilet, and then they also tell you the history of frequent micturition, and so on and so forth. Okay, then do the physical examination where you have to review the enlarged prostate gland. Okay, do the urinalysis, culture and sensitivity. Okay, estimation of the residue of the urine, you check the concentration of the urine. Then you do the blood urea and nitrogen, which is BUN, blood urea nitrogen. Okay, then you can also do digital rectal examination to examine the size and consistency of the prostate. This is done by inserting the fingers into the rectum. Okay, if you insert the fingers to the rectum, okay, you don't have to get scared of. Let's look at the management of BPH. Okay, so BPH can be managed in two ways. Actually, it can be managed medically or surgically. Okay, so for medical management, actually, if no symptoms, or maybe they are only mild symptoms, okay, so we can at this point wait to not to do the surgical. We can wait as we treat the symptoms. Okay, so how do we treat the symptoms? Actually, by the use of the catheter, so that the urine can be passed freely through the catheter. Okay, so treatment of symptoms, actually, other treatment, like we give also antibiotics, okay, to prevent urinary tract infections, because there is frequent urinary tract infections. So we give antibiotics. If they are there, we treat them. If they are not there, we do what? We actually prevent urinary tract infections. Okay, then we also give painkillers, because there is a lot of pain at this particular time. So once we insert the catheter, we treat the pain and give antibiotics. Then at this particular time, we are actually doing our best. Okay, but what are some of these drugs that we can use? What are some of these antibiotics? Okay, and there are also some other drugs that are used to relax the smooth muscles of the prostate and the bladder, the neck of the bladder. or block the male hormone, which is which can, you know, exacerbate the condition. We block it to prevent, or rather we shrink the tissue growth. Okay, we shrink the tissue growth. So at this particular time we can do that. But what are some of these? We can give tamsulosin. Okay, we can give we can also give tamsulosin. Okay, tamsulosin. We can give terazosin. We can give also some of these antagonists like doxazosin. Okay, and then also give some of these other medications, you know, to prevent that. Another treatment is surgical treatment. So for surgical treatment, actually surgical treatment is the best so far. So the general indications for surgical in BPH is the failure to respond to medical treatment, actually. Okay. Also some bothersome, you know, bothersome symptoms, certain complications that cannot be, you know, treated easily. Okay. The stones, when the stones forms, we do surgery. Sometimes hydronephrosis, UTIs, okay, urinary retention, impaired in renal functioning. In that way, we do the surgery. Okay. So what is the procedure that we do? Sometimes we do prostatectomy. Okay, we do prostatectomy. So this is the procedure which is done to remove the prostate gland, which is called the prostatectomy. Okay, we remove the prostate gland. There are also some other types of surgery based on the approach. Okay, there are some other types of surgery based on the approach. So we have what we call transurethral resection of prostate gland. Then we have what we call transvesical prostatectomy. Then the other approach is retropubic prostatectomy, which is also called Millin's procedure. Then the other one is perineal, which is called perineal prostatectomy, which is also called Young's prostatectomy. Okay, so these are the 4 approaches that we use. So please you have to also look at the pre and post operative care that is done. Also look at the nursing care plan for prostate gland for a patient suffering from prostate hypertrophy. Okay, not prostate gland, but for a patient suffering from benign prostate hypertrophy, the nursing care plan. Then the nursing care, specific nursing care, look at all those things, then you'll be able to understand this condition clearly. Thank you so much for for listening.